Hi, I'm Dr. Kelly Brogan, and I'd like to welcome you to a weekly video series that I've entitled It's Not All in Your Head, in which I hope to discuss 5 different primary contributors to psychiatric diagnoses that have physiologic explanations. So I call these the psychiatric pretenders. And the first one that I want to talk about is near and dear to my heart and is a big focus in my practice, which is thyroid function. So I will use postpartum thyroiditis, which I encounter in about 80% of my patients, as an example to illustrate how thyroid can really masquerade as a psychiatric condition. And in the postpartum period, what happens is the immune system undergoes a shift after the birth of the baby, and it really sort of comes back with a vengeance in some patients. And you'll see that there's a pattern of hyperthyroidism over a couple of months, followed by hypo or low functioning thyroid. And this pattern is really exacted by the immune system, its attack on the gland. So what happens in those early months is the patient will typically feel actually like they've bounced back really easily. They've lost the weight, they have a ton of energy, even though they're only sleeping 2 to 3 hours a night. But there may be a little bit of a dark edge where they're agitated or irritable, having racing heart and insomnia. And if you were to check their blood work, then you would find the presence of these antibodies that are very easily testable. They have 3 different names, although usually there's a specific pattern where only 1 or 2 of them are present. Thyroid peroxidase, thyroglobulin, and thyroid stimulating or thyroid receptor antibody. And the TSH, which is typically the only thing that's checked, may actually be low or normal. But we have a harbinger of what's to come, which is over the course of a couple of months, something that looks a lot like major depression or postpartum depression. And it's cloudy thinking, feeling slowed and lethargic, weight gain, sometimes constipation, excessive hair loss, dry skin, and of course depression, often punctuated with little pockets of intense anxiety that can actually manifest in the body again as sort of racing heart and a feeling of inner restlessness. And so the reason I care so much about this is because if you didn't look for the evidence of thyroid function, specifically autoimmune thyroid function, then you would presume that these are manifestations of a brain-based chemical imbalance. And there are strategies for resolving autoimmune conditions from a functional medicine perspective that involve targeted nutrients, things like selenium, zinc, sometimes iodine, probiotics, fat-soluble vitamins, and often the most important aspect of the treatment is looking to the environment to find out what might be otherwise aggravating the situation or driving this autoimmunity. And the big ticket items are usually food intolerances, things like gluten and dairy, and sometimes environmental endocrine disruptors, things like fluoride and plastics. So I encourage you to put this in your back pocket and think of it if you are experiencing a global shift in your day-to-day well-being, but particularly if that's happening in the postpartum period. So thank you for listening, and I will speak to you again next week.